All right, and good afternoon, everybody. Thank you for attending this afternoon's webinar on the National APS Retention Survey findings. I'm Michael Hagenlot, the NAPSA Chief Financial Officer, and I'll be moderating. I'm delighted to welcome you to this webinar on behalf of NAPSA. NAPSA is a nonprofit membership organization that provides training, advocacy, and networking opportunities for APS workers, supervisors, administrators, allied professionals, and anyone interested in preventing and raising awareness of adult maltreatment. Please visit our website at napsa-now.org to learn more about us and become a member. Also, please save the date for NAPSA's 36th Annual National Conference, September 8th through 10th in Bellevue, Washington. NAPSA's Financial Exploitation Advisory Board will hold the 16th Annual Financial Exploitation Summit the day following the conference on September 11th, 2025. Some housekeeping. All listeners have been muted, but we encourage you to ask questions in the chat box. Today's presentation is being recorded, and the recording will be accessible on the NAPSA website. Closed captioning for this webinar today is available via the Zoom app. This is a reminder to utilize the Q&A section for any of your questions, and they'll be answered at the end of the presentation. Without further ado, I'd like to introduce today's presenters, Krista Brown and Rebecca Parks.
Thank you, Michael. Hi, everybody. Krista Brown, and I was a consultant on the NATC evaluation project with Purdue University. Good to be here with you all. And Rebecca, do you want to introduce yourself really quick?
Sure. Thanks, Krista and Michael. I'm Rebecca Parks. I'm with Purdue University in Indiana. I'm one of the, for this particular survey and research, I was the project manager, and I'm also a research associate with Purdue University and a nurse practitioner by training.
Great. All right, let's go ahead and get started. We have a lot to cover, and we will start with an acknowledgement. This work was supported by the Administration for Community Living, ACL, U.S. Department of Health and Human Services as part of a financial assistance award to NAPSA. The contents are those of the authors and do not necessarily represent the official views of nor an endorsement by ACL, HHS, or the U.S. government. And the National APS Training Center was pleased to partner with Purdue University to conduct the National APS Training Center APS Retention Survey. And if you have any questions, you can contact Dr. Marion Liu. Today, we are going to give you very briefly a background and how we got here. We will dive into the national survey findings to date. We'll talk about some of the APS promising practices, and very excited that the APS recruitment and retention education tool is available freely for you all. So we'll review that. We'll talk about some next steps in this work and have time for Q&A. All right. But before we get started, it's always great to have a sense of who we are speaking to today. So Michael, if you could launch our audience poll. And you all should see that on your screens. And if you could just let us know what your current role with APS is. And we'll leave that open for a couple minutes.
Should we play the Jeopardy theme right now? No, I'm just kidding. Or sing it, hum it.
Yeah. All right. How's it looking, Michael? Are we good?
We're looking good. It's slowing down. We'll do the old countdown. In 10 seconds, I'll end the poll. I got a few more to jump in there.
Don't miss out.
Yeah. All right. I'm going to end the poll in 3, 2, 1.
Great. And then we should, okay, so we have our results. Everybody should be able to see that we have quite a few manager administrators. And next up are training and academic, and almost tied are supervisors and other. And we have some folks who have written into the chat. Thank you for that. And then we have APS case carrying and non-case carrying. And some of our friends who have written into the chat, we've got some grant administrators, project managers, organizational ombudsmen, workforce development specialists, and QA folks, and some state oversight, and a policy director from California. Hello, Carol Soul, and all other folks. So thank you so much. That gives us a really good idea of who we have in our audience. So you just go ahead and close on your screen. Michael, close that for us, and we will move forward. Okay, so just a little bit of where we are for some of you who haven't been a part of it, but my guess is you all have been a part of one of the phases or pieces of the work of the NATC and Purdue Evaluation Project. There was phase one, which happened now quite a few years ago, and that was focusing on training topics and challenges and barriers to recruitment and retention. There was some surveys and a lot of focus groups that Rebecca and Marion held, and listening sessions. And that was phase one. And then Rebecca and Marion carried that knowledge and that work into phase two. And so we'll be talking about two big deliverables from phase two that largely focused on recruitment and retention. The National APS Retention Survey and the NATC APS Recruitment and Retention Educational Tool. Other deliverables, we also had our APS Recruitment and Retention Advisory Board, our evaluation team, and did a very thorough literature review, which is actually part of the R&R tool. So everybody has access to that. And you may ask yourself, so why all this focus on recruitment and retention? Well, kind of a no-brainer. First of all, it was an ACL priority. It's been a long-standing issue for human services in general, and APS in particular. And there, at the time of doing this, there was little to no research on APS professionals. And so what makes this this survey and these results really special is that this was the first national APS workforce retention survey administered to all levels of APS professionals, and that was in February 2024, and many of you probably took it, so we thank you for that. And it was developed by APS professionals, trainers, researchers, and built from a very thorough literature review and workforce development framework. So that is a bit of the background. And just for those of you who took the survey, this is just the visual representation of the survey area. So our big research question was, why have you stayed in APS? And we probe the areas of demographics, education and training, individual factors and traits, organizational factors, and open-ended retention questions. And we got some very rich data and results. And so I'm going to turn it over to Rebecca to start unpacking some of those results.
Thanks, Krista, so much for that background and reminding me of all that all that work over the previous years. And additionally, that whole training topic survey of the training center was one of those big things we did that I know you talked about. Shout out to Katie on that as well. Okay, well, interesting results on who's attending in comparison to who was the predominant participant of this survey. We had the survey open for a couple of months last year from February to about April, and we had about 1,252 usable responses, which was a huge number. And why this survey is important is probably going to be one of those foundational surveys, is because it was predominantly case carrying APS workers who were the participants of the survey. As you can see there was 58% identified as themselves as case carrying, which is not who's on this call today. That's okay though. That's okay. It looks like we had about 6% case carrying on the call who identified themselves today. That's okay. And we did have, of those case carrying in the survey, they identified that APS was their only role. Um, and they only serve, I'm sorry, 56% of them served more than one area type. And in that case, it tended to be urban plus another area type. And when they had more than APS role, it tended to be if they were in a rural area or if they were non-case carrying, so a supervisor or an admin. But I'm actually getting into uh, a more deep dive on those results. So let me stick with this year's results. So on average, we found that APS, the survey participants were on the job about 8 years on average. They were in their mid 40s and they were highly educated, bachelor's degree or higher. So a bachelor's degree or master's, if we add in a master's degree, that was about 30%. So 90+% highly educated workforce for these survey participants, predominantly white female. And also they were coming from state administered programs, but we also had a wide distribution of survey participants. So we had participants from state programs, which we know most APS programs are state administered, but we also had participants from our county administered programs, as well as our contract administered programs from DC, as well as territories and tribes. So we had wide participation, well represented, all the programs from 46 states, which I forgot to mention. So from coast to coast, top to bottom, so all representation. So a really good cross representation. So I think we can move on to the next slide with that. So we did ask this question. I think we were trying to get at kind of the recruitment question. How are people first learning about APS? And also in the questions, it's like, how are we making a dent in teaching folks? And so all of our training folks and any academics on the call and our educators, are we making a dent in teaching folks about APS in the educational systems, in the higher learning? Surprising to me, most people are first learning about APS in work in another human or social service department, as you see, is 51%. But don't fear. If we add up the college, university courses or their internships or practicum field training with APS or another non-APS program, so maybe they had training in, another college course, whether it was with child services or another training program, that at least is getting into the double digits and 10% or more. So there is some inroads being made there. And then we know through our literature review that the National Social Work Survey did show that the masters, the MSW, were showing that there was some success, that if they had their field training or practicums in part of their training, that they were showing a good percentage of them being able to be recruited if they had their field training during their training in their MSW program. They were able to recruit them very easily. So that is something to keep in mind. Now that was for MSW programs. And I don't know if that is translatable to other levels of training, but there did seem to be good success with that. So this is interesting to see that work in another human or social service department was how people did first learn about APS.
And
So
also and also law enforcement too, which
yes, for those. So this is just a different way to present some of the data. So we're not just looking at charts. A word cloud here, and this is some of those words that we see a lot of in some of our qualitative data that were responses to what is one question that you might ask a job applicant to determine whether they would be a good fit for APS work, in trying to, kind of tease out those qualities in people that would kind of help make them stay, or just kind of tease out those things in folks that would see, what would make them be, a good fit for the APS work. And so what we see there, right in the middle is work, handle stress, manage people, that kind of thing. And so in looking at this, and I'll talk a little bit more in the next slide about codes, but the kind of the main questions or the groupings of the types of questions that people were coming up with, and 971 people, put some thought into the types of questions that they would ask a candidate were, so the groupings of the types of question were, like, why do you want to work for APS? Reason for choosing APS work, their knowledge about that type of work, their experience working with older adults or differently abled people. And so then kind of the next kind of grouping of questions was about their task and time management abilities, managing workload. And then, excuse me, the next two groupings really had to do with their ability with coping with stress, their resiliency, their handling of stressful and conflict situations, and de-escalation. So you can kind of see the stress, the managing stress, de-escalation, managing emotional intensity, and we will see that theme come up again. Okay, next slide. Okay, so this is where we're going to talk about how we were kind of looking at the data when we're looking at qualitative data. So I think Krista talked about the different types of questions, and if you took the survey, you know that we used multiple choice, Likert scales, qualitative where you're writing in, and people did take the opportunity to write in a lot. So we sure appreciated that, such rich data. Oh my goodness, we had 13 qualitative, at least 13 qualitative questions. Five of them were a combination qualitative with a Likert scale, and 8 were just straight qualitative, where just a write-in answer, text answers. So we used a qualitative coding process, which is a way to systematically categorize the nearly 9,000 qualitative responses to these open-ended retention questions, basically in order to find themes and patterns. So as we looked through those, 13 more rich qualitative answers, we start seeing repetition of these themes, these patterns, these groupings. So we call these codes basically here. And in this slide, these are in order of frequency that we were starting to see. So I see a question here. Is the slide in order of results? Yes. For these. So workload for, and this question, oh, it says at the top, okay. This is one of the questions that we asked was asking about what is the most challenging part of your APS work? And from 1,073 responses, this slide isn't just from those responses, but it is a combination from that question as well as why do you think some of your coworkers have made the decision to leave APS for a different job or area of practice? And is there anything else you think we should know about why people stay or leave APS? But the codes we used were so workload, unsupported, and undervalued were definitely the top three. And stress, fatigue, frustration, APS, under-resourced came in, and then the lack of community resource. There were others below that, but I mean, the top three just out far and above came in the top. And you can read for yourself kind of how we defined what those were. And those kind of ended up being the words that they kind of were using when they talked about those things. Um, when they were talking about workload, obviously they were talking about the volume, the complexity, the timelines, kind of the stress that came with that and that kind of thing. And then to just kind of talk to you quickly about some of the other codes that came up with challenges. They talked about, and they weren't nearly in the quantity that these were they talked were clients' right to self-determination, undervalued, gaining cooperation with or from other entities, personal safety concerns, which actually we thought was going to be a high one, and it was not. Um, because you hear that a lot. I heard that a lot in the focus groups about, you can't get workers because, how do you explain to somebody going into a filthy house or something like that? So that was a code, but it did not get used a lot. That was not a lot of input we received from people in the survey at all. So personal safety concerns, and then another code was lack of available or appropriate housing as a challenge in APS work. And then on the flip side, one of the questions that was asked in the survey is what is needed to address these challenges. And you can imagine what is needed to address the challenges. It's kind of the opposite. And some of the responses are, well, one of the main ones is responsive and supportive upper management, an increase in community resources and support, improved workload management, and training and education. Okay, that was a long one, sorry. Next, Krista. Okay, this is one of those combination Likert, and you can write in more about your response if you want. So these questions really kind of talk about the organization support. So we asked people to rate on a scale from 1 to 5 that how they felt that their organization prioritized their safety. So a 3 is kind of a yes, no, or kind of, so they responded 3.68 to how they felt their organization prioritized their safety. A lot of the things that people wrote in said that they didn't feel like their organization prioritized their safety. There wasn't protocols, there wasn't available safety equipment or training, there wasn't sensitivity to staff safety. There was a focus on, or on the flip side, there was a focus on compliance versus safety, that kind of thing. Then the same question was asked about I feel my organization prioritizes my well-being. That was rated even lower at 3.46. Once again, there's a mix of codes that were positive and negative. They were feeling unsupported, high workloads. Some places had a supportive work culture, practices, and policies. Other people felt undervalued, and some people felt that they did have positive support experiences. Um, Organizational culture or organizational responses did tend to be, or actually not tended, they were the lowest rated of all things on the surveys. Okay.
Yeah, that is right. And people it did differentiate between APS program and direct supervisors versus the greater organization or agency. So that's something to keep in mind, and we'll actually see that in a slide coming up as well. All righty, are we done here? Oh, and actually the Likert, I just wanted to add the Likert scale for this one was, strongly agree to strongly disagree. So,
Thank you.
righty. Yeah, no problem. Thanks, Rebecca. We're moving from challenges to strengths and strategies, and we do love a word cloud. And so this was based on the question, why have you stayed in APS? And 1,091 people did answer this, and our word cloud ability was around 100 different responses. So this isn't the bulk of it, but you get a sense of enjoy, love work, people, supervise, population. So these are some themes that we'll see with our codes in a couple slides as well. So supervisor support. So again, we talked about how people did differentiate. So this was a Likert scale, strongly agree to strongly disagree. The question, I feel supported by my supervisor. We had a average of 4.23. My supervisor provides praise and recognition, 4.1. And then again, we said the organizational ones kind of scored the lowest. And again, this one is on the lower side as well. I feel valued and appreciated by my organization at 3.5. So these are just some things to keep in mind, where we can see some strengths and maybe some gaps. When we talked and asked about training and supports, I did want to add there was a question we did ask that's not on this slide that is kind of the beginning question. We asked folks about if they received APS specific onboarding training. And we had almost 1,250 people answer, and 80% said they did receive APS specific onboarding training. And so that we had about 20% saying they did not. For further down our analysis, we may dig into that 20% and see what the tenure is of those folks. But I see, since I've been in the APS training world for quite a while, I actually see 80% response in the positive as a real positive and a growth for APS programs. When we asked my APS program onboarding process adequately prepared me to independently meet the requirements of my job, we had a few less people respond, about 987, but there was pretty strong agreement, about 64% agree or strongly agree that their onboarding training did prepare them. With about 16% neutral and about 20% disagreeing or strongly disagreeing. So again, progress, but there's room for growth as well. What is wonderful to see, and this is definitely over the years having so much more attention and investment in training opportunities for APS professionals. I have opportunities through my work to receive ongoing training to meet the requirements of my job. Good response there from over 1,200 folks, and 86% agree or strongly agree. So the majority are saying that they are receiving ongoing training to help meet the requirements of their job, and fewer 7% neutral or and 7% disagree or strongly disagree. So again, excellent job out there, folks, training folks and decision makers who have prioritized training, and for NAPSA and all of our training colleagues who have been out there, creating that curriculum. Then we asked about which agency provided resources do you find most helpful. Now, remember, this is a survey that went out post-COVID and post-COVID funding and ARPA funding. It was a check all that apply. And number one, probably no surprise, smartphones, laptops, and tablets, 88%. Remote work and remote work tools, close behind at 71. And then something that just made me chuckle, but it's also something that is actually should be paid attention to, is number three, is current and accessible APS policy and procedure manuals. Number one, that's probably a lower hanging fruit thing for folks to make sure is updated and available or created. But the other thing is it probably wraps into some of the responses we saw around safety and well-being as well. So just a little bit of a connection I was making with that. For you to contemplate. And then the next two, number 4 and 5, have to do with case management databases and software tools to help with workflow and casework collaboration. So I am going to go ahead and hand it over to Rebecca again to talk about why people are staying.
Thank you, Krista. And I was just gonna, nope, we're gonna do questions later. So why do people stay? Well, before I talk about that, I was just gonna start with the question. We did ask folks if they were, are you satisfied with the job? And it was a Likert scale, 1 to 5, from not very satisfied to very satisfied. So, the average score there was a 3.86. So not horrible. But, we saw the slide earlier about the challenges of APS work, and, pretty challenging, workload, feeling unsupported, not feeling like they had enough resources. So just keeping that in mind, we're going to look at why they stay. Even though they report the difficult workload and feeling undervalued and unsupported, and their satisfaction may not be the highest, they stay because they find meaning. Meaningfulness is, the highest or the most frequent mentioned code or reason they stated that they stay. in contributing to and helping people, and when they have supportive workplaces and people, to do the work and the meaning. So that's why they stay, even in those situations. So the reason they stay in the work is they find meaning in the work, in the helping of the people, and especially if they have a supportive workplace or people in the place, or supportive practices and culture. Those top three, those top two for sure, and those top three for definitely sure. The other two at the bottom were there, but not at the levels that the top three were, or definitely not at the top two. So I believe, let's see, that was out of I don't have the number. Yes, it was
1,174.
yeah, I just found that too. So most rewarding, helping people was 700 out of 1,000 was helping people. So in meaningfulness was 454 at least. So both things. Um, so that overrides a lot of things. And I think that's really all I have to say about that. But when we ask them what needs to change to make you stay longer, this is what they said. The pay needs to increase, right? 34% of the 1,003 people said increased pay, which equated to, competitive starting pay, regular pay increases, or some type of promotion ladder. Then 21% said an increase or improved agency resources, which we defined as staff, more staff, positions, program funding, specialized positions, that current and accessible policy and procedure, some type of resource list, technological improvements in the programs. Then 18% supportive and upper management or leadership. So that upper management understanding the role of APS, appreciation and recognition, their concerns being listened to, advocacy for APS, supportive policies, legislation, policy reform, clarification on their expectations, organizational restructuring, job title reform. Then 15% said supportive work culture practices, policy. So once again, that supportive workplace basically, or policies, that there's flexibility in their work, in their leave policies, the wellness programs. So there was that question earlier with that low rating about, does your organization care about your well-being? So program improvement, stress reduction, career growth, counseling for trauma, those type of things. And then improved workload management. That was 12%, so that was the lowest percentage. Capping their caseload size, or having some type of equitable distribution, realistic timelines, some type of consistent screening guidelines, or just some type of screening guidelines at all. So that's kind of what they said, that they felt like they would need to see change to help them stay longer. Although we don't have that on here. A lot of them now, it's been over a year now since we did that. At the time, that many of them already said that they were going to stay at least a year longer. So I think that's all I had on that. What kind of what kind of resources? The kind of resources that people wanted to see increase were mainly APS resources. So in the program itself, so like more staff or positions, if technological improvements, if they needed technology. Program funding, specialized positions, that type of thing. Those were specific things needed. Or mentioned, I'm sorry. That's all I have
Okay.
on that.
All right.
Right. And snapshot here on promising practices. And I know Krista will talk more about the tool, but some of the snapshot in talking about some of the promising practices. And this was part of the development of the recruitment and retention tool. And really, what we did was talk to programs across the country who were implementing some things that they were either having some initial basically they were having some initial data or some initial information about, whether it was a success. They had some initial data about whether or not the implementation was kind of working or not for them. So, you could share, and they also gave us permission, right, to share with folks. So some of the things were I mentioned this earlier about the internships, the stipend programs. This primarily referred to social work trainees, internships. So that was uh, we had a few different things. There were some loan forgiveness situations. You might have to help me, Krista, on I don't remember exactly where the loan forgiveness was. Um, there was but that was one way to do that. You could if you as a recruitment tool, you come in, work for a certain amount of time, in exchange, will pay off the loan recruitment that or not the loan recruitment, I'm sorry, the loan forgiveness for that, and as well as social work, the internship training. You do part of your training, your field training with us, and that leads to, a position when you get out. So that's kind of a win-win. You get your training, and then there's a position. And also, it kind of acts as, some extra hands during the time. And that can also happen internally. I actually have an example in a West Coast state. Um, it was another, a partner agency. The person was going to get their master social work, and they um, worked in a partner agency, and they came and did their training in APS. And although they didn't stay in APS, they did their training there. So at least, they became more familiar with APS. And so when they went back to their agency, they had more knowledge, and can take that information back to their their parent agency, if you will, and, just developed a better working relationship and, goes to that survey finding if that's how they found out about APS is because they worked with another health agency. So another promising practice was the wage parity advancement. We found that through at least 2 states, Arizona and New Mexico, advanced legislation to have wage parity with their CPS and APS programs, where that's a possibility. That was something that they were able to do. And I know that that is limited in states that have maybe state administered, and I know that's, probably can be restricted to state-run programs. I know it's different across the state. Then the comprehensive recruitment process, promising practices. There's different things with candidate assessment, skills testing. There's examples of that I know in the recruitment tool, competency-based onboarding, their training while working. There's simulation training, etc. Leadership culture change, specialization, units, training collaborations. And I'll put a plug in for the simulation training. I know there's a research to practice webinar coming up. Illinois did that with their APS. They partnered with one of the universities to do a simulation training, and they had success, and then they are featured in the research, the tool that Krista is going to talk about. And Krista, I'm going to throw it to you because
Yeah, sounds good because we've got a couple more slides and then Michael has a few questions for us too. So all of these snapshot are in the yay, the APS recruitment and retention educational tool. This was truly, truly a village team effort. And so this was in collaboration with our 35-member advisory board, the programs that we interviewed for the promising practice interviews. And it is comprised, if you have not downloaded it yet, of focus areas, promising practices, resources and tools and samples in an annotated bibliography. It's available now at the on NAPSA's website at this address. And Michael maybe can pop that into the chat. And there you can also find a button towards the bottom to download the slides from today as well. So so the slides are there as well as this wonderful tool, very easy to use, lots of hyperlinks. So if you want to go into one of the focus areas and say, I just want to focus on retention right now, then you can jump into the retention area and find all the goodies around that one specific thing. The other thing that we wanted to let you know, thanks, Michael, or Marion and Michael, for popping those links. Also, next step. So please join. So this is just the initial findings, and there is so much more to learn from all of the data. So join our session at the NAPSA conference for a deeper dive into the data. September 8th at 2:30 p.m. Pacific. The session is supporting the APS workforce, more findings and strategies from the first National APS Workforce Retention Survey. And it's really taking a deeper dive into the data, in looking and hopefully trying to provide the field with a clearer picture of the APS workforce and the factors on how they're recruited, what supports and challenges well-being and job satisfaction. In Marion and one of our PhD students, Saba, are doing a lot of higher level statistical modeling to identify some of these important factors that can hopefully help with discussions of the strengths and the strategies and the tools that are going to be needed to move forward and to be a foundation for further research to be done. And this information is based on 2 forthcoming manuscripts on APS workforce and retention and predictors and moderators. So just wanted to put a plug in for that. And we have questions, lots of questions. So Michael,
Yeah,
thank you for gathering.
no worries. I hope I got them transcribed here. But one person asked, was there any anecdotal information on using AI?
No,
No.
no one shared anything specific around the use of AI tools in the survey.
Okay. The
Yeah.
next question on there was the question about how people felt. Were they adequately prepared when NAPSA training was on the website? Was there any change after that?
That there was not a drill down at that kind of level, nor was that given as feedback in the qualitative responses. So
Okay.
but I know that I saw another question around did people have differing feelings about online versus in person? I think that harkens back to the NAPSA training survey that was done quite a while ago, and then I know some of the training uh, our training partners have done surveys as well, but I know that's kind of dated, so that might be something we could put on the parking lot for something to look into down the line, updating the training survey.
All right. And then next question in line is what kind of resources did people want to see increase? Did you have any information on that?
Yes, there were resources. Actually, I think Rebecca covered some of those. Some of those are programmatic, internal programmatic resources, and then some of them are more external community resources. And some of them are very specific organizational and leadership supports as well. Rebecca, did you want to jump in?
Yeah, I was gonna say it was a lot of staff. I feel like it was a lot of
That too.
staff positions, that type of thing. So yeah. Hmm.
Okay. And I got a couple more here for you. Let's see, culture changes. Is there a baseline of what was bad and a standard of what was good regarding the cultures? No. Okay.
I don't know. There wasn't really no. No. Short answer, no, not really. Uh, it was it was usually just kind of um a general of I can give a few examples of not feeling supported in, I may get time off, but then no one's covering, my cases while I get this time off. So when I come back, I'm expected to like pick all this up. So it's like I don't feel like I don't really get the time off, so I can't relax. And I mean, I understand that. Um, so it's kind of a lot of that kind of thing. So you know, that kind of thing. Or you know, ever really feeling like I'm off work, no protected time, not having downtime, feeling like punished if they have to take care of their family or their kids and that kind of thing. Mhm.
Great. And let's see here. Wage studies. Has caseload standards been updated?
I know that, well, Krista, maybe you have, I believe that uh, TARC or
The
WRMA has
yeah,
done, go
the
ahead.
Turk has they didn't work specifically on caseload studies, but they did a lot of work around workload, and they have
Yeah.
a specific workload tool and
Mhm.
some good information on the Turk website.
Okay,
Yes.
very good. And yes, one of the question, yes, this will be the recording of this session will be available on the NAPSA website. Let's see, there's been a discussion about caseload numbers. Yeah, okay. All right, so that concludes all the questions that I was able to keep up with. And we're just about to the top of the hour. And so I want to thank you, Krista and Rebecca and Marion, for sharing the National APS Retention Survey findings and presenting today's webinar. We really appreciate it. Remember, registration is still open for the 36th Annual NAPSA Conference for September 8 through 10 and the financial exploitation on September 11. And we appreciate all of who took time to attend today's webinar. Have a great rest of the day. Be well and stay safe.
Thank you, everybody. Remember, come to the session, learn more. Thank you, Michael. Thank you, NAPSA.
You
Thank you,
betcha.
everyone, for your support.
So I'm going to have to end it, and that'll shut everything off and the recording will come.